The Career of Mental Health Counselors by Kylie Albritton. This presentation will cover the ins and outs of mental health counseling, a highly involved profession seeking to help people in aspects of recovery and healing. In this presentation, we will discuss the general background and more specific facts of the field, what education is needed in schools that offer the right degree, and what programs and supplemental training is required to practice. We'll also discuss how the counseling career fits with certain values and personalities, the outlook of the profession, and what steps can be taken to join the career. Mental health counseling is considered part of the behavioral healthcare field, which is a part of the healthcare industry. On another level, mental health counseling can be considered part of the social sciences field. Other careers that fall in the hybrid healthcare social area include educational, guidance and school counselors, child and family social workers, and psychology teachers. Psychiatrists could also be considered as part of the hybrid industry, but as a doctorate is required, the career is on a different level than mental health counselors. To better understand the role of a mental health counselor, it's best to know the job expectations they face. Mental health counselors work with patients and counsel with an emphasis on prevention. It's important for counselors to address high-risk symptoms and behaviors to better assist patients and improve their quality of life. Many issues patients face are related to substance abuse, family and marriage problems, psychological and behavioral factors, and stress levels. Mental health counselors must evaluate their patients and determine risk levels, what issues must be addressed in what order, evaluate the effectiveness for counseling for the patient, and maintain the appropriate records for care. To be a licensed practicing mental health counselor, you need a graduate degree, or in other words, a master's degree. The first step in obtaining a master's degree is earning a 4-year bachelor's degree. There aren't any specific degrees that act as prerequisites for a master's in mental health counseling, but common degrees among mental health counselors include psychology, sociology, education, and communication. Of course, a bachelor's degree in business or English will not hinder your education and training, but having a background like in psychology or sociology may prove helpful in earning your master's. Some specific paths can be taken to get specialized counseling degrees. One instance is a master's in pastoral counseling, which takes a religious approach to the area. Others choose degrees specializing in family and couples counseling. The master's degree you choose often requires unique instruction and preparation, but many can be used regardless of your position. Some schools in Florida that offer such graduate degrees include Palm Beach Atlantic University, Stetson University, Rollins College, and the University of Central Florida. The licensing process to become a mental health counselor begins after graduation, once you've completed your master's program from an accredited institution. There are several requirements for licensure that must be fulfilled, though the specifics do vary by state. In Florida, applicants looking for licensure must have the following: a master's degree in mental health or a degree related to the field, 2 years of postmaster's supervised experience, which must consist of at least 100 hours of supervision within a 100-week period, 1,500 hours of in-person psychotherapy with clients, and 1 hour of supervision every 2 weeks. Applicants also need to earn a passing score on the National Clinical Mental Health Counseling Examination, followed by completion of relative courses, and finally, earning a verified license. Mental health counselors are also required to be recertified in different areas to continue practicing in the field. However, some choose to seek additional optional certifications and training to learn new methods and having the licenses to practice them. Different organizations and research groups have found that there are common values across many professions. MyPlan, a useful resource for career information that offers different assessments based on values, skills, and personalities, has identified the following values across a multitude of industries. They are achievement, working conditions, recognition, relationships, support, and independence. While results change with each person, MyPlan offers users a look at the average responses of different careers. Here, we can see the average scores for mental health counselors out of a possible 5 points. In this example, I've used my results to show comparisons, but by briefly inspecting the graph, we see that mental health counselors place heavy value on relationships overall. The next highest areas are achievement and independence. That's not to say working conditions, support, and recognition do not matter, because they do. Results are unique to the individual, and we see here that I put more value in achievement than in working conditions. The gap between my score and the average for mental health counselors only shows that my focuses are elsewhere, not that I've disregarded working conditions as a factor. From this illustration, we can assume that mental health counselors are often more concerned with the relationships behind their profession. Working with colleagues and clients is at the forefront of their daily routine, and mental health counselors must be inclined to favor this type of interaction to be successful. Other values like support are also necessary, but as counselors work independently with their clients, there may be a lower emphasis, which isn't uncommon. Mental health counselors must have an aptitude for the nature of their work. Personalities are as influential to a person's success in their work environment as factors like salary, work conditions, and who they work with. For someone with an ENFP personality like myself, the nature of a mental health counselor's work is well suited for my traits and responses. The 4 attributes of an ENFP personality are extroverted, intuitive, feeling, and perceiving. People favoring extroversion are often expressive, open to communication, and social. People are drawn to them and they interact well with others. Having this open demeanor helps people respond warmly to extroverted personalities, something vital to a mental health counselor's line of work. Those favoring intuition are often described as perceptive, insightful, inventive, and creative. They look for patterns and solutions, but are experts at seeing the big picture of a situation. Having the insight to see possibilities in all angles of an issue is extremely beneficial for a mental health counselor, who must be prepared for unexpected events and sometimes setbacks in different client cases. The ability to find solutions and offer advice should not be taken for granted. Feelers are, as expected, more aligned with attributes like caring, compassion, and understanding. There's a higher level of sentiment for feelers, but their ability to connect emotionally helps them understand different points of view. While many may be considered soft or sensitive, feelers value honor and individual rights. It's crucial for mental health counselors to have compassion for their clients and a desire to help in their growth. People who are perceivers are genuine, flexible, and adaptable to different circumstances and events. They have an authentic desire to aid and are often free-spirited, able to withstand the pressures of changes to find new answers. While mental health counselors can have the judger personality, there is no argument that adaptability isn't a useful resource in such a career. The United States Bureau of Labor Statistics predicts a 23% growth in the profession, which follows changes in healthcare and mental health care accessibility. This growth, expected between 2016 and 2026, is a much faster rate than the average of many professions. Pay-wise, the salary of a mental health counselor varies depending on the specific nature of their work. Someone working in a hospital or inpatient environment may earn more than someone working in an outpatient or rehabilitation center. In 2017, those working with government organizations earned around $50,000 annually compared to approximately $42,000 at outpatient centers. For mental health counselors, the process of joining the career is lengthy and involved. After earning a master's degree and completing 2 years of internship experience, one has spent a lot of time and energy in reaching their career goals. However, the payout of working with others to support their growth and improve their well-being, being successful and confident in your abilities, and maximizing your skills makes the effort even more worth it. While being a mental health counselor is a demanding job that takes the right mindset and values, those who have joined the field have seen tremendous growth and fulfillment. The field continues to expand and will demand more people with the education and training in order to work together to help aid people in their recovery and healing. What happens next? For anyone set on becoming a mental health counselor, such as myself, it's important to remember your goal through the hard work. The saying, "keep your eye on the prize," is a lot more relevant than you might think. If you believe the job of a mental health counselor can be more for you, if you can build a career out of it, then you're on the right track. Ask yourself if the degrees, continuing education, and training are worth the effort. For me, they are. Getting to the place where saying becomes doing, when I begin working with my clients toward their futures, will be worth the years of classes and supervised experience hours. So is there a plan B? It's always smart to have a backup plan, and as someone who leans more towards adaptability, my plan B is in place. I know what top degrees I am matched for and what careers I'd be fulfilled in going into that are beyond mental health counseling, but I also know that that's my passion. It's important for everyone to find theirs too. Ask yourself if there are any regrets. Would you do anything differently? Has research changed your mind? For me, researching the career details of a mental health counselor has solidified my decision of becoming one. If there are any regrets, it's that I didn't choose to research the career sooner to better prepare for the journey ahead. This career isn't right for everyone, as no career truly is. However, at the end of the day, I know that it's right for me.